Senator Cassidy. I thank the chair and the ranking member for holding these series of meetings, highlighting both the statistics but also the individual families, and that's what we're here for. Governors, thank y'all for being here. Thanks for being front line and finding solutions. I want to agree with using the PDMP data. We have a bill included that would encourage states to proactively share this with law enforcement. Governor Brown, you've mentioned that, I think you said that's your goal. But Governor Hogan, don't I know that Maryland does not proactively share with law enforcement? I say that not to accuse, but rather to ask why not, and what can we learn from the difficulties of implementing this program?
Well, I think we've got to be careful about the sharing of information. We want to protect the folks that actually have drug addictions and not treat them just as law enforcement cases. That's what we're talking about, all the treatment and all the other education and prevention
now,
issues.
if I may,
yeah.
The way I see this is not so much that you would track folks down who are addicts, rather you would track down pill mill doctors and pharmacies which are knowingly overprescribing, and are for pharmacies which are not aware that a patient is going from pharmacy to pharmacy to pharmacy and doctor in order to aggregate.
Yeah, we are doing exactly that, actually. I was just talking with our czar who's heading up this entire emergency operation that we've declared, and we're shutting down pill mills all across the state, and certainly would be happy to talk with sharing that information.
Now let me ask, again, not to interrupt, but I just have such limited time. What are the lag times between, in each of your states, between someone getting a prescription filled and it showing up on your PDMP? I say that because I spoke yesterday to Walgreens, and they said in most states it's at least 5 days, at which point some doctor shopping patient can go to 5 different pharmacies.
Okay. We know the time.
I don't know the exact time, but we'll get back to you with that information. But we did boost the enforcement capabilities, and we're trying to go after it as fast as possible.
I have to ask you a question. If your czar were a woman, would she be a czarina? I have to, just ask that. Now, let me also ask, because Senator Murray and I have both discussed in different settings, the limitation, because apparently there is a huge lag time, as Walgreens reports. Would you agree that the ideal system would have real-time upload of prescriptions being written, capturing people from all states and capturing people who are paying cash?
I think that's exactly what we're doing in the Washington metropolitan region with Virginia, D.C., and Maryland.
My only concern is your PDMP probably has a lag time. According to the pharmacists, that can be up to 5, maybe even 2 weeks, 5 days, 2 weeks.
Senator Cassidy, in terms of Oregon, the legislation just passed 2 weeks ago. I haven't signed it into law yet in terms of requiring physician registration with the PDMP. So our time frames, we'll get that to you as soon as we have any available evidence. And in terms of connecting with law enforcement, that's something we want to take a look at. I think it's going to be critically important. One of the tools that we think is going to be extremely effective in terms of the PDMP is that we now have a good electronic records health system. We are able to connect the PDMP with electronic health records in our emergency rooms.
Are vendors cooperating with that?
Yes, so far, yes. But like I said, the law was just signed 2 weeks ago. The law was just passed 2 weeks ago, so I haven't even signed it into law yet.
The chair and the chair and ranking member have intense interest in EHRs, as do I. So if you can give us feedback on whether or not that is collaborating, we would like that. Can I move on? And not to be rude, but just because there's so much to ask you. Y'all are implementing treatment programs. Not all treatment programs are equal. Some very effective, some high rates of recidivism. How do you decide which programs to use? And how do you monitor whether or not they are a good program or there's a high rate, not of recidivism, but rather of relapse?
Senator Cassidy, I will be signing an executive order in the next few days asking for a comprehensive strategic plan regarding our treatment program statewide. 74% of the people in treatment for substance abuse are on the Oregon Health Plan. So one of the challenges is making sure everyone has access to health care and that we have comprehensive...
Let me ask, because when I speak to providers and I say this statement, their heads nod. There are some that are merely combing jails, finding people on Medicaid to bring them out and to put them into a treatment without follow-up and with high rates of relapse. and there's others who do it right. And you say that to providers, they nod their head yes. How do you sort those from those?
Senator Cassidy, we're going to use evidence-based in terms of our treatment, and that's why we think medically assisted treatment is so effective, because there is evidence that it works.
I'm out of time. Much to ask, but no more time. I yield back. Thank you. Governors, I actually have questions from a father whose son who died. And as I read his testimony, it's very moving. So excuse me as I feel his pain. He says if your son is 17 years old, treatment options are limited. In your state, what is available for someone who is a less than 18-year-old person, as his was?
Thank you, Senator Cassidy, and I'm terribly sorry for this man's loss. In Oregon, we're working hard to make sure that our young people have access to treatment. I mentioned earlier, focused on comprehensive behavioral health. We unfortunately are struggling with some of the barriers through insurance policy and requiring failure first before getting the best possible treatment. And we want to change that dynamic, and the legislation that just passed 2 weeks ago is going to be taking a look at the insurance barriers that out there.
Let me come back to that.
Okay.
But if somebody is less than 18 years old, do they have the same access to treatment as does someone who's over 18?
Yes, I believe so.
And Governor?
Yes, I don't think we discriminate based on age.
Let me ask, he also suggested, these questions are based upon his suggestion. He suggested, and one of you thought, I thought I might have gleaned this, that you decriminalize possession, if you will. You decriminalize addiction, because a 17-year-old could end up being forever ostracized from normal society if that is on his record. Have your states decriminalized addiction, if you will?
Well, we haven't decriminalized drug use, but we have lowered penalties and changed things from felonies to misdemeanors, increased the amount of...
So if a 17-year-old were found with fentanyl, and it was clearly he was not a distributor, but rather he was a user, would he end up with a criminal record?
He would, it would depend on the circumstances of the individual case, but our preference would be to try to get him into treatment. But obviously each case is separate and it would be dealt with in drug courts. And
are there increased penalties for dealers associated with an addict's death? Not just a dealer, but someone associated with someone dying.
Senator Cassidy, I'll have to get back to you on that specific question, but I will get the information to you. In terms of our decriminalization, it was a lowering, just like Governor Hogan, it was a lowering of penalty from a felony to a misdemeanor. I'm not sure what the sentencing is for juveniles. Again, particularly with regards to juveniles, we obviously want to take a treatment-first approach.
we increased the penalties for people who knowingly deal fentanyl, knowing that it could cause the death of another individual.
Would they get also a secondary manslaughter
Yes.
charge if that?
They would get a primary manslaughter charge on top of anything else. In fact, we have we just passed a law that I introduced in the state of Maryland, passed our legislature. My daughter's a prosecutor in St. Mary's County, Southern Maryland, who actually is prosecuting 8 of these cases that we're charging them with second-degree depraved heart murder, which is a step higher than manslaughter.
Wonderful. Can I ask, again, limited time, I don't mean to interrupt. Now, you mentioned the obstacles in mental health parity. Do your state group plans offer mental health parity for both addiction and mental health services? If so, does it cost money? Or if not, what are the obstacles?
Senator Cassidy, we passed mental health parity legislation in the mid-2000s in Oregon. I spent 10 years working to pass that legislation. In terms of coverage, I don't know from specific plan to specific plan. I will tell you through the Oregon Health Plan, we now have 100% of our children covered, and we treat our substance abuse as part of our
publicly funded
comprehensive.
seems to work in some cases, but it seems to be the private insurance. I'm told that there can be, as you said, you have to fail, or there has to be a pre-authorization and other obstacles that seem to inhibit the in fact, if not in the law. Is that also your impression in your state?
Yeah, I think I think if you're using the federal programs, I think you're covered. But different individual health plans, I think, vary.
Do you have
Probably
suggestions as to how the law could be changed so that it's actually in fact as opposed to just on paper?
Well,
So go ahead.
Sorry, Governor Hogan, we need to provide the best possible treatments first and the most effective assistance immediately. And the legislation that just passed, that I haven't signed yet into law, will take a look at the insurance barriers that are present that my own family had to deal with.
Whatever.
Governor Hogan?
Yeah, I think it's something maybe that the federal government, that all of you ought to take a look at. See if we
If you have
federal
suggestions of how to
standards.
do so, I think we would be interested in understanding that.
Absolutely, we will.
Thank you.